I am super excited to welcome our special guest, Parul Somani. Parul is a business executive and cancer survivor turned storyteller on a mission to inspire others to design their own silver linings. Parul aims to help organizations and individuals understand the value of health advocacy, resilience, and a positive mindset. So let's welcome Parul to the stage. From that experience, what have you realized that's important to you, and why are you speaking now about advocacy?
So when I look back at the last several years, there's multiple examples of how being my own patient advocate or being an advocate on behalf of my family made all of the difference in terms of the health outcome. And thinking about all of the friction that we've faced and challenges that we've faced in those experiences, and how easy it would have been to abandon the path at any point, would have completely changed the outcome for all of us. But yet I'm thankful that we continue to stay active and proactive and advocate for finding a solution. And now the entire dynamic for my mom, my father, and family has changed forever.
And that's one of the things that OODA is trying to do, is redesign the whole system so that we have an equal playing field for everybody.
Yeah, unfortunately, most people don't know how to be their own advocate.
Yeah.
They don't know how to navigate the healthcare system. And at a time that's already very emotionally stressful and overwhelming for them because of the health challenges they're facing, any additional uncertainty around insurance coverage and expenses and whether they'll even be able to afford their care is actually just another significant layer of stress.
Mm-hmm.
And so there's really an opportunity for OODA to make a big difference here.
What about any billing issues? Your experience receiving and paying bills during your diagnosis or treatment or afterwards, what was that like?
I have to admit, I was extremely fortunate to have really great insurance coverage. Even though I had tremendous support from family and friends, and frankly, even strangers, having insurance coverage to not have to worry about the expenses and not have to be worrying about each bill that was coming in during that time was actually its own incredible pillar of support.
That's a really interesting and insightful way to put it, your insurance as a pillar of support, which I'm sure was a relief given all the things that you were going through and all the decisions, the life decisions that you were having to make. Thank you, Parul. This has been fabulous. And yes, I think it's really great for us to be able to hear from the patient perspective and just remember how important the work is that we're doing.
Yeah, I think it speaks volumes that Seth and yourself and Joe wanted to kick off this offsite with a patient story. I hope it serves as a reminder that behind every OODA user is a real person and a whole family that's going through a very difficult time. And the work that you're doing is really helping bring light into a very dark time for them. And so you should be really proud of the work that you're doing.